Well, good afternoon, everybody, and thank you for joining today's briefing. As of today, we have had 1,534,005 COVID cases, 1,755 new cases reported since yesterday, 1,131 people in the hospital, and 18,740 people who have died. As we mark our second holiday season of the pandemic, we're fortunate that this year's Thanksgiving looked different from last year's Thanksgiving. Thanks to remarkable COVID-19 vaccines and the millions of North Carolinians who got them, families and friends were able to gather more safely this year, sharing hugs and good food. Thanksgiving this year did feel more normal, but we're all painfully aware that we haven't fully defeated this pandemic. The Delta variant is still with us, causing sickness and death, mostly among the unvaccinated, while health alerts about the emerging Omicron variant have caused concern and opened a new set of questions. As the scientists and public health experts race to get answers about the new variant, we still know this to be 100% true. Getting more people vaccinated is the way out of this pandemic. If you haven't been vaccinated and you're worried about the Omicron variant, get your shot today. If you want to make your Christmas gathering safer, get your shot today. These vaccines are safe, effective, and they're free. And they're saving lives every minute of every day by preventing people from getting severe COVID symptoms that could land them in the ICU or worse. And if you don't believe it, get off the internet and on the phone with your doctor. If you were vaccinated at least 6 months ago or 2 months ago for the J&J vaccine, go get your booster because it will strengthen your immunity. Make your appointment for that booster today. North Carolina is working hard to increase the number of vaccinated people in our state, including children who are now eligible. Just as we've done with the adult vaccine effort, we're working with trusted messengers, including community leaders, family doctors, and others, to have an open conversation with parents who have questions. And it's working. In North Carolina, we're up to 13% of children ages 5 through 11 who've received their first dose during the 4 weeks that we've been giving them. Since my executive order went into effect requiring state employees working in cabinet agencies to be vaccinated or tested weekly, the vaccination rate has increased from 65% in mid-September to 76% by the end of November. Our state health facilities have required vaccinations for their workers to protect them and their patients. More than 99% of those workers are now vaccinated. These numbers are good, and we're working to do more. And I appreciate all the private sector businesses that have similar rules for their workers and customers because you're making the right call to keep people safe. Before Thanksgiving, I signed a new bipartisan state budget that'll help our state out of this pandemic and come out even stronger on the other side. It includes hundreds of millions of dollars for business recovery grants, as well as funds for individual families that are struggling. It sends badly needed resources to local health departments who are on the front lines of the pandemic. It invests in our research universities where scientists are on the front lines of developing new treatments for COVID-19. And it funds filling the gaps in high-speed internet that have been magnified over the last 2 years. My administration is working hard to implement these solutions, and I look forward to the efficient and effective use of these dollars that'll speed us through this pandemic and do so much more. Now I'd like to ask Dr. Mandy Cohen, the Secretary of the Department of Health and Human Services, to provide an update on our state's COVID-19 trends. Dr. Cohen?
Thank you, Governor. Before we dig into the data, I want to take a minute to talk about the new COVID-19 variant that has been making headlines. All viruses change over time, and COVID-19 is no exception. The latest variant, Omicron, was recently designated as a variant of concern by the World Health Organization, and we still have a lot to learn about Omicron. Over the next few weeks, scientists will be looking for answers to several questions. Is this new variant more contagious? Does it make people sicker? And how will it impact our immunity and our treatments? Cases with the Omicron variant have not yet been detected here in North Carolina or elsewhere in the United States, but many experts believe it is likely already here. Now, while there's no need for alarm, we do need to continue to closely monitor the science and data on this new variant. And with that, we'll dive into the data. This first graph looks at people who come into the emergency department with COVID-like symptoms. It's our earliest detection mechanism. And the yellow line represents this current year that shows that this trend has come down significantly from its recent peak in early September. But you can see the yellow line has started to just increase slightly over the past few weeks. However, it does remain below where we were a year ago, which is shown with that blue line. Next, we look at new COVID cases. This first graph shows you the trajectory of new cases each day since we had our first case back in March of 2020. And you can see our first major peak in cases was back in January of 2021, before vaccines are widely available. That second peak in August and September was a result of the Delta variant and had the greatest impact on people who were not vaccinated. But let's zoom in and look at the last few weeks of cases. On this graph, we're looking at cases from October through today. And what you can see is that our cases have been largely level and appear to even have decreased over the past week. Now, we've made incredible progress as millions of North Carolinians have gotten vaccinated to protect their health and that of their community. But two things to note as we look at this graph. First, testing over the Thanksgiving holiday dropped significantly. So while case numbers are lower, this is probably an incomplete picture of what's happening in our state given the low amount of testing last week. Second, we won't know for a couple of weeks if Thanksgiving gatherings with unvaccinated people will have an impact on our numbers. Next, we'll look at the percent of tests that are positive, and this graph also goes back to October. Looking at that yellow line, our percent of positive tests has increased over the past week and is above our 5% goal. On our next graph, we look at day-over-day hospitalizations, and this graph also starts in October. And looking at that yellow line, you can see that trend has leveled. The next slide looks at what's happening at the local level. This is a map from the CDC that shows the level of viral transmission. I am pleased to report that North Carolina is no longer in the red zone as a state. The CDC has our state in the orange with a substantial level of community transmission, and several North Carolina counties are now yellow with a moderate level of community transmission. And you can see, looking at the map, the western part of the state currently has the highest rates of transmission. Now, let's look at vaccinations. Today, 72% of those 18 and older have had at least one dose, and 94% of those 65 and older are having at least one dose, and that's really good progress. Next, this slide shows the percent of the population that's received at least one dose by age group. You can see many families are choosing to vaccinate their younger children now that we have a safe and effective vaccine. Getting children vaccinated helps keep them healthy and protected from COVID-19. It's why I got my daughters vaccinated right away. You can see in the graph, fewer young people are getting vaccinated. And this is concerning because, as we saw during the Delta surge, it was really hard to predict who's going to become seriously ill from COVID-19 or who's going to experience those long-term symptoms from COVID-19. What we do know is getting vaccinated reduces your chance of getting COVID-19 and provides significant protection from serious illness, hospitalization, and death. Unvaccinated North Carolinians are 6 times more likely to get COVID-19 and 25 times more likely to die of COVID-19 than vaccinated North Carolinians. If you haven't gotten vaccinated yet, please talk with your doctor, nurse, or other medical professional, or go to a reliable online health resource like the CDC or yourspot.yourshot.nc.gov to be sure you're getting accurate information. Don't wait to vaccinate. And like many vaccinations, boosters are needed to strengthen and extend protection against COVID-19. Everyone 18 and older should get a booster as soon as they are eligible. If you got the Johnson & Johnson vaccine, you should get a booster at 2 months after your shot. If you've gotten the Moderna or the Pfizer vaccine, you should get a booster 6 months after your shot. With the holidays, colder weather, and this potential of a new variant approaching, you should not put off getting your booster. Now, before I wrap up, I want to take a moment to thank Governor Cooper. As the governor shared in a press release earlier today, I will be stepping down from my role as Secretary of the Department of Health and Human Services. I want to thank you, Governor, for your steadfast leadership, your partnership, and your commitment to the people of North Carolina. You're a man of integrity, faith, and resilience, and I have not met anyone who loves the state more than you. I've learned so much from you, and I'm so grateful for the opportunity you gave me to lead the Department of Health and Human Services. I also want to thank my incredible team at the department. I am so proud of our extraordinary work and what we have accomplished together to improve the health and well-being of the state. I'm forever grateful for your sacrifice and hard work. And while it's hard to step away, it's the right time for me personally and the right time for our team. The Department of Health and Human Services is in a strong position to continue to carry out its mission, and in choosing Chief Deputy Secretary Cody Kinsley as the department's next secretary, the governor has chosen an incredible leader to take the baton to run the next leg of this race. It has been an honor of a lifetime to serve this state at such an important moment in history. Thank you, Governor.
Thank you, Dr. Cohen. North Carolina has benefited greatly from your leadership over the past 5 years. And that's been especially true over the course of this pandemic, during which your work has saved countless lives. I deeply appreciate your service and your steady hand in times of crisis. You and I, along with our remarkable team, have been in the trenches together, and we're going to miss you. And speaking of a remarkable team, a leader you recruited into that group is ready to take the position of secretary when you step down, and he'll continue your legacy of strong leadership, Dr. Cohen. Cody Kinsley currently serves as your Chief Deputy Secretary at the department and has been leading COVID operations for the state. I'll appoint him as secretary immediately upon your departure. He'll continue to be supported by the team of doctors and public health experts who've advised and assisted both of us. Dr. Cohen, North Carolinians owe you a deep debt of gratitude. You have been such a blessing to our state. Thank you, my friend. But you have another month to go, and I know, as usual, you're going to be at it as determined as ever until the last day. So we're looking forward to the next month. Also with me today is North Carolina Director of Emergency Management, Will Ray. Our sign language interpreters are Monica McGee. And behind the scenes, Jackie Mativier and Margaret Wolf Roberts are our Spanish language interpreters. So now we will take questions from the media who are here. We also have Secretary of Public Safety Eddie Buffalo here as well. Questions? You guys are slow on the draw today.
Governor Sean Cudahy from CBS 17. I think probably a lot of parents are nervous hearing the news of the new variant. What is your level of confidence at this point, based on what you know that their kids are going to be able to stay in school in person this year?
So my level of confidence is strong that vaccinations are going to continue to be the way out of this pandemic. We don't anticipate any additional restrictions at this point, but we know that there are questions to answer, and I'm going to let Dr. Cohen talk just a minute about the variant and her discussions with experts.
Thanks for the question. I think it's really important, as the governor said, for everyone to get vaccinated, and particularly now that our 5 to 11-year-olds can get vaccinated, I think it's really important to take advantage of this time. We haven't seen the new variant here in North Carolina nor in the United States, but we believe it is likely already here. So the time to act is now for vaccinations. I think we have a lot to learn about how this virus and its new changes may impact things going forward. But what we know is providing yourself that initial level of immunity through vaccination is going to be helpful. I think we are all concerned looking at some of the early data from other countries, seeing that it potentially could be more contagious. It doesn't in early data look like it is more severe, so that is good news, but it does show significant mutations or changes at the spot in the virus that we anchored our vaccines to. So again, things we want to really start to look at with our scientists, so we'll be watching that data very closely.
Hi, Governor. Jonah Kaplan
Jonah.
with ABC 11. Before I get to Dr. Cohen, let's talk about her successor that you're nominating. And I say this is someone that she obviously has a lot of confidence in, you have a lot of confidence in. This is a role that has always been important, but it's become more visible to people. And we're still in this pandemic, and incoming Secretary Kinsler, he may have an extensive background. I saw the Treasury and as an administrator. He's not a physician, so what confidence do you have in him? And Dr. Cohen, for you as well, what can you say to North Carolinians who may say, well, he's not a doctor, how can he lead us in the pandemic?
Well, first, I'm appointing Cody Kinsley because he is the most qualified and experienced person for the job. He has been a part of this team for the past number of years, and we've seen him in action, and Dr. Cohen has put a lot of trust in him. Dr. Cohen and I, and Cody, when he becomes secretary, have been supported by a team of doctors and medical advisors and health experts who have collectively helped to advise us. So I feel very positive about Cody's leadership. I think this team is going to continue to stay together, and Dr. Cohen deserves an amazing amount of credit for recruiting some of the best people around to be a part of this team, and I have every confidence that he'll do a great job and the team will support him. You want Dr. Cohen to respond to that?
If she'd like to.
The only thing I would add, Jonah, is that this response, yes, is about making sure we can understand the science and data, and we have plenty of public health experts and doctors that the team will continue to support that. But so much of it is about the execution and the operations, and this is where Cody Kinsley really shines, and I have leaned on him so much to lead our operations. So I think him stepping into that role is really quite a natural fit. He has been leading so much of our work. I'm so proud of what we've been able to do when we rolled out the initial vaccine effort, and we were able to really charge that into high gear. That was his work. And so I think he really has his hand in the operations, which is what really matters to people. Are we going to get tests? Are we going to get our vaccines? Are the boosters out there? And then he will be supported by those public health experts at our department that are fantastic and have been advising me throughout this as well. Thank you.
Dr. Cohen, while you're still at the podium and while I can still ask questions of you, was there a moment, what you said this is the right time for you personally, was there something that happened recently? Is there a turning point in the pandemic? Why step away now?
Well, it's been a wonderful 5 years. I am so honored that I had this opportunity to lead the state at this moment. I think we've accomplished so much beyond, I know folks see the COVID response, but I'm really proud of the work we did the 3 years, even leading up to COVID. I think it made a difference in how we were able to be successful in responding, whether it was transitioning our Medicaid program or investing in early childhood, responding to the opioid crisis, the unfortunate many hurricanes that we had to respond to together with emergency management. All of that, I think, contributed to our success. But for me, it's been an amazing 5 years, but these have been challenging. And so a bit of rest and recovery is what is in store for me next as I think about my next opportunity. There wasn't one moment, but it felt like the team is very strong right now at DHHS. I feel like they can take the baton and run with it for the next leg of the race.
There was wide speculation that you might leave us for Washington, D.C. before. Yeah. Are you staying in North Carolina?
Well, so I don't know what my next steps will hold. All I would say is that I and my family have fallen in love with North Carolina. We love it here, and I hope that my next steps will be able to keep us here. Thank you.
I would also say, Jonah, too, and I think that sometimes at these press conferences, because I know you all have a lot of questions about medical data, et cetera, we will probably have a doctor from our team who will be with Cody and me at these press conferences to be able to answer some of the medical questions as we go forward. But yeah, you had another question.
Well, and this is more, we talked about the COVID-19 response and, of course, the Department of Health and Human Services, gigantic part of your administration. So what more initiatives do you look for? I mean, we know Medicaid expansion, but what will you be calling on for the incoming secretary to lead? What kind? You still have 3 years left in your administration. What do you expect from him, and what kind of initiatives do you hope he will take?
Well, first, getting more people covered with health insurance has to be the primary objective, and Medicaid expansion is still the number one goal because that can get 500,000 to 600,000 more working North Carolinians insured with federal dollars. So that will continue to be a priority. Cody Kinsley has extensive background in behavioral and mental health, and we know that this pandemic has caused even exacerbated issues regarding mental health and addiction treatment. So we're going to make sure that we put an emphasis on that. But making sure we continue to administer this vaccination program, get people vaccinated, and getting on the other side of the pandemic has got to be the primary objective here during the next few months. I feel confident this team can lead us through. And we're going to continue to keep our eye on these other issues of mental health and investment in early childhood and looking after our senior population. The Department of Health and Human Services does great things across the state, and we're going to continue them. Yes.
Good afternoon, Governor. Brea Hollingsworth with CBS 17 News. A federal judge in Missouri temporarily barred the federal government from requiring healthcare workers in Missouri and 9 other states to get the COVID-19 vaccine. Curious to know if you've been following this, and if so, what's your reaction to it?
So, as you know, that our state-owned healthcare facilities, we required vaccinations for those healthcare workers, and more than 99% of them got vaccinated because they cared about themselves, their families, and their patients. And I think we need to continue to do things to encourage people to get vaccinations. So in North Carolina, we've continued to increase the number of state employees getting vaccinated. We've encouraged employers to require their employees to get vaccinated. So we're going to continue to make that a top effort in our state. Hey, Dawn.
I understand President Biden was meeting with governors this week. Have you had that meeting yet? And what kind of guidance are you getting from him as far as any changes in response with the new variant?
So we get a White House briefing most every week. The last couple of months it's been every other week. But we've been pleased with the response that we have been getting with vaccinations. We're talking more and more about the pills that can provide treatment, and we're looking at how we're going to disperse those. We're still working closely with FEMA to make sure we get reimbursements for all of the efforts that we put forward in the state. So our federal partners are going to continue to be important to us as we work to get us to the other side of this pandemic.
Do you anticipate keeping the policy where it's by local and county, looking at the changes on the CDC map as far as spread, if certain counties want to have, mask restrictions still or anything like that?
Well, as you know, we have no statewide mandates in effect. We have recommendations which closely follow the CDC recommendations. I would expect we would continue to do that. And we've encouraged local governments to look at those recommendations and to make decisions that are best for their communities, and a number of them have continued to do it. But I hope that we can continue to make progress, and the way to do that is to get people vaccinated.
Did you say that you had the briefing with the White House this week yet, or is that?
No, I have not this week. No, not at this point yet.
And I have questions for Dr. Cohen. I guess first one, is this your last public appearance? Are you done with us for for these briefings after this?
Well, Cody Kinsley's going to take over on January 1st. Until then, I will certainly be here, and I imagine with an evolving COVID situation, we may need to be back in this room. So I doubt it will be the last public appearance, but just in case it has been an honor and a privilege. But I imagine with the evolving situation that we may be back for updates.
I know, Jonah, can I ask this already as far as if there was one moment? When did you make the decision to step down, and when did you tell the governor?
So it's been an evolution, and certainly the last 2 years have been quite a marathon. And I'm so proud of all of the work that we've been able to accomplish. And so as we came through and coming down off the Delta surge, when I saw things getting more stable, I watched my team with a lot of pride being able to react to any new thing that was thrown at it, whether it was new boosters or this new variant. They were jumping into action in ways that were fantastic, and I felt like I was able to now take this step back and pass the baton to the next folks. And I think I shared the news or my decision with him a number of weeks ago, so that we could get ready and plan, and obviously so he can go through a process to select my successor, so that we'd be able to have a very smooth transition. And that is my hope, that we don't skip a beat. We're obviously still in the middle of a pandemic, and so I wanted to make sure that I gave the governor the time for him to go through a process to select my successor.
I'm sure you know this question is coming and no one else has asked yet. Are you planning to run for office?
I'm not planning to run for office. I am looking at opportunities that allow me to continue this impact to improve the health and well-being of communities. I don't know what that will look like exactly yet, but no plans to run for public office.
Would that change after filing starts next week?
No, I do not plan to file and run in any public office.
Are you looking to work in one of the universities in North Carolina, or would you work in DC again?
Well, I think I'm looking at a range of opportunities. I think at first I want to spend a little bit of time with my girls and my husband, who have been amazing and supportive through this, and then we'll see what opportunities come.
So what's the first thing you're going to do when you don't work for government anymore? What are you doing January 1st?
Oh, January 1st. Well, I think I'll still be spending some time with my family for sure. And I know that there'll be a trip for my mom and my sister in the month of January. So that's coming up soon. Thank you.
Yes, sir.
Good afternoon. This is actually for Secretary Cohen as well. Matt Tallholm with WRAL. Secretary Cohen, I talked to several community organizations that you've worked with throughout this pandemic across the state who've said they really credited you with getting out there and helping, especially in communities that weren't typically outreached to. They said they hadn't seen that before. What would your message be to them, and will that kind of progress continue?
Well, I'm so gratified to hear that they felt the impact of the work of our department during this response effort. We made a very intentional decision to make sure we put equity at the center of everything we did, and that meant partnership. We know so much of this response has been about building trust, and trust with many communities, but that has to translate into action, and I'm glad they're seeing and feeling that action on the ground and that partnership. And you can be assured that Cody Kinsley has been by my side as we've built those partnerships and is certainly going to not only continue them, but I hope build upon them as well. So I'm grateful for that partnership and hope it was just the beginning. Thank you.
So do we have any call-in questions? Or we'll take those.
Our first question is from Richard Quaver with the Winston-Salem Journal.
Yes, Governor, Secretary Cohen, this is Richard Quaver with the Winston-Salem Journal. I was going to ask you one COVID-related question and then one non. The first is basically, are y'all hopeful in sort of a strange way that the Omicron variant might encourage more people to go ahead and get vaccinated and or get their booster shot?
Well, obviously you don't want to see more variants of COVID-19, but we're going to do everything we can to get more people vaccinated. And, whatever motivates people, if this motivates people, as I said earlier, please go and get vaccinated. Next question.
Our next question is from Jason DeBruin with North Carolina Public Radio.
Hi, this is.
I thought
Richard had a follow-up, but go ahead, Jason. Yeah, no worries. I don't mind cutting back to Richard later. No, go ahead, Jason. Oh, okay, thanks. Secretary Cohen, this one for you. I wonder if maybe you could put on your Masters of Public Health, sort of that hat for now. Given that the Omicron variant came out of Africa we know has a pretty low level of vaccination rate compared to the rest of the world. I wonder if there's a thought that if there was more vaccine equity, more vaccines sent to poorer countries, more vaccines perhaps given to COVAX, if that would have been perhaps more effective in stopping this new variant and perhaps protected the entire world in a better way.
Well, thanks for that question, Jason. I do want to clarify that I think as more and more scientific data is compiled, I think what we're seeing is that this variant likely didn't originate in Africa and may have been in Europe or other parts of the world even prior to that. I think we're still sorting that through in the scientific community. I think South Africa was the first to sequence and identify and give us some clinical information here. So we should be very grateful to the work done in South Africa by their medical community. I think it is informing our work now. But I want to say that I think that we still don't know exactly where this variant happens, but we should also know viruses change. We knew that this was a possibility, just like it changed to become the Delta variant. We knew this was a possibility. So yes, vaccination is so important so that we can get as many people protected. I know that the United States has been working to make sure we are getting vaccine across the world. And that's why we want to make sure that in a country with the kinds of resources we have here, with vaccine widely available, that everyone is taking advantage of it, because there are places, unfortunately, around the world who don't have that same kind of access to protect themselves. So let's take advantage of the amazing resources, the tools to protect ourselves that we have here, whether it's getting vaccinated with your original series or going out, if you're an adult, getting your booster if it's been more than 6 months. So I do think we have a collective amount of work that we need to do to help the whole world move beyond this pandemic. I think we are recognizing what an integrated and globalized world we live in, and how quickly this virus can move around. So we do have work to do in partnership with many, many countries around the world, but we got to do our work here in the United States as well. Thanks.
Next question, please.
Follow-up, Jason DeBruin, North Carolina Public Radio.
Thanks for that information. And this question, a little bit more just related to your time here at DHHS. There's a lot that you said you're proud of. And I wonder if there's anything related to the pandemic response that you maybe wish that you had done differently, or with the benefit of hindsight, if there's anything that maybe you wish you would have, a decision you made that maybe with the benefit of hindsight you would have done a little bit differently.
Well, thanks for that, Jason. You know, I always want to make sure folks say this was a crisis. You can't Monday morning quarterback a crisis. So I am very proud of the work, but absolutely, were there things that we should have done in preparation to be better ready to respond? Absolutely. I think we all remember back to the fact that we had a shortage of protective equipment. Number one, we had supply chain issues. We weren't sure if we would have enough ventilators. So certainly there was a lot of lessons learned there. I think our data infrastructure as well was something we needed to build that did not exist at first for the kind of response and the scale of what we were dealing with. So there's a lot of preparatory work that I would have done. And I think as we come out of this pandemic, there are a lot of lessons learned about how we can stay prepared for something in the future and make sure that we are putting the resources into public health. I think we've learned a lot, we've built a lot, and we need to make sure we maintain that vigilant posture into the future. Thanks.
Next question.
Our next question is a follow-up from Richard Craver with the Winston-Salem Journal.
Yes, Richard Craver back with West Central. Thank you for circling back to me. Yesterday, the technical corrections bill to the state budget was introduced and passed through with bipartisan support, of which it has a economic development project involving Piedmont Triad International Airport. I was wanting to see how much do you know about the project, and are you planning to sign that bill?
One of the successes that we've had has been working closely with the General Assembly leadership of both parties on economic development projects, and it's one of the reasons why we've created so many great paying jobs for our state. And that economic recruitment continues. We continue to be aggressive about it. I'll review the entire legislation, and I cannot comment on specific economic development projects, but I know that we're going to continue to be successful in this state. Next question, please.
Our next question is from Laura Lee with Carolina Public Press.
Good afternoon, Governor. Laura Lee from Carolina Public Press. You mentioned briefly earlier the COVID drugs that are in the pipeline. We understand FDA advisors are meeting today to consider the Merck drug. I know that at least in the vaccine process, a lot of those distribution details are actually hashed out prior to approvals. And I'm wondering if it's a similar process for these drugs and what you know about the possibility of these drugs coming to North Carolina.
We're excited to have new treatments continuing to come online for people who do have COVID. And I'll have to credit North Carolina scientists who've been a real part of helping to discover new treatments. We do know that initially that the pill that potentially can be approved will be somewhat limited, so we will have to have a distribution plan, and I'm going to let Dr. Cohen talk a little bit about that.
Thank you, Governor. Yes, Laura, as the governor mentioned, there will be a centralized allocation process from the federal government with these new medicines. They have warned us that the supply is very, very limited, particularly during the month of December. So we are looking at very targeted ways in which we can use a very, very limited number of courses of this medicine. So we're looking for places where we know folks are more immunocompromised. So maybe they've gotten vaccinated, but because they have some other immunodeficiency, the vaccine doesn't work as well for them. We want to make sure they are the ones who are prioritized for treatment, at least at first. We're hopeful that by January we'll see more supply of this vaccine, which is great news. I think every additional tool that we get here is one more thing we can use to beat back this pandemic. But we all need to be doing the work of using the strongest tool, which is getting vaccinated, getting boosted. Thanks.
Next question, please.
Follow-up, Laura Lee, Carolina Public Press.
A follow-up for Dr. Cohen on the prioritization criteria that you're using in terms of distribution. you said it will relate to immunocompromised individuals. Will it also potentially relate to areas of less vaccination, meaning, more unvaccinated people that would potentially need the drugs? Is that part of the calculus in determining where these drugs will go?
Laura, at first, what we're really doing, rather than targeting people, is targeting the kinds of providers that can both see patients who might be immunocompromised and can also do the prescribing and the dispensing of the medication at the same time, just because it's such a limited supply. So there is a pretty narrow range of providers that will do that across the state. So rather than prioritizing any particular place, we're trying to get access to the pill across the state and really target to providers who see more immunocompromised patients and have the ability to both prescribe and dispense the medicine, so they could do that all in one. So that's how we're doing things at first. And again, I think that's just for the first few weeks. And I just want to make sure folks know it has not yet gotten full authorization from the FDA. They are reviewing that this week. So we think maybe as soon as the end of this week or early next week for new courses of that treatment to be in North Carolina. Thank you.
Next question.
Our final question for today's press conference is from Rose Hoban with NC Health News.
Hi, Governor Secretary Cohen. Thanks so much for taking my question. My questions are for Dr. Cohen. The first question I have is about testing for Omicron. What is the current capacity of the state to be testing for these new variants? How many, what percentage of tests are being run? And, do you feel confident that we'll be able to identify it when it gets here quickly?
Rose, thanks for the question. So the Omicron variant can be picked up by a standard PCR test. So the normal kinds of tests that everyone has been getting at many locations across North Carolina, that is the same test that would pick up this new variant as well. I think the question is more about how many are we sequencing to understand what kind of COVID is this? Is it a Delta strain? Is it an Omicron strain? I will say all of the samples that come at least to the state lab, we sequence every single one of those positive. But that's a small fraction of the tests that are done here in North Carolina. We have many labs that have been helping us with testing. The interesting part about the Omicron variant, it does give off a particular signal on the PCR test, and it does help our lab folks actually hone in on which samples they should be sequencing. So I do think that we are going to be looking for this particular signal that it gives off on a PCR test and doing a lot more samples of that to do the sequencing. But again, every positive that comes to our state lab is already sequenced. And as I said, we have not seen it here in North Carolina, nor in another part of the United States, but I know all of our lab experts are looking closely at our data right now. Thank you. Oh. Rose, is there a follow-up?
I hit the 5. So my other question is, it's more of on your tenure. I'm looking back at the interview I did with you when you first came, and you talked about building trust across the aisle, and by any measure, you seem to have been very successful at reaching across the aisle to members of the Republican members of the legislature. What allowed you to do that, and how did you, talk a little bit about working with the entire legislature and, what skills or what it was that enabled you to do that?
Well, thanks, Rose. I have tried over the 5 years of my tenure here as secretary to work with everyone across North Carolina, different stakeholders from all walks of life, all sides of aisles. And, you know, the way I do that is approach it as a problem solver. I want to make our state healthier. I want to improve the well-being of our state. And there is a lot of common ground that I have found there when we can exchange ideas. And so that has how I have approached things. And I think I also have been as transparent as I can. Both, as you see, we do a lot of data, try to help explain why we are making the decisions we are making. And I also, you know, make sure that folks can reach me, that we can be in dialogue, that I can hear their concerns, and that we can find a place where we can move forward together. So I feel like we've done a lot of really good work here in the state. I'm very proud of it. I think that success rests on trust, and is something that I have worked very hard to make sure that folks, no matter where they are in North Carolina, can trust the information that we're giving is the best information that we have at the time. We're always still learning and improving as we go, and I'm appreciative of all of this opportunity to lead here in the state over the last 5 years. And thank you, Governor, for this opportunity. It's been an honor. Thank you.
I'll close the press conference and just say, Rose, that you hit on something that's really important. Not only is Dr. Cohen brilliant and hardworking, but she has the ability to communicate with almost anybody. And that has been a source of her strength and effectiveness in this state. And as I've told her, we look forward to the next 30 days, but also we look forward to the time beyond, because we have a great team in place that continue to lead North Carolina forward. Thank you guys for joining us today.